Okay, so it's 11 o'clock. We should start in a timely fashion, I think. Maybe if just want to make sure if everybody can hear me. So if you could let me know if you hear me okay. Great. Good. Then we'll start. Thank you for joining this first webinar from the Nordic region in the International Coaching Week. Today we have a coach from Iceland. But shortly about me, I'm Sigrún Haraldsson. I'm the Secretary of ICF Iceland, and Iceland is hosting the webinars today. The first webinar is about ADHD coaching, which has been around for over 20 years, and it helps individuals to face daily challenges and find their strength. ADHD coaches work with families, children, adolescents, adults, and students in all areas of life. Sigrún Jónsdóttir, our speaker today, is living in Iceland and works as an ADHD and autism coach and is the owner of Miro Coaching Practice. She has worked as a social educator for over 30 years as a public servant. She graduated from ADHD in USA as a specialized ADHD coach in 2018. Sigrún is on the board of the ADHD Association of Iceland, where the interests of individuals with ADHD are in the foreground. So without further ado, we are proud to present Sigrún. So over to you.
Thank you, Sigurður. So I'm gonna share the screen in a while. I think I will do it now. Just give me a little while. It will just be here. I will just start here. I just wanted to thank you all for being here and join me today in this a little lecture about ADHD coaching. I will be talking about what ADHD coaching is and how we are a little different from the life coaching area. I think that we will have in the end Q&A, and if there's something that is important and you want to talk about or ask me questions, you can leave it in the box just down there. And I think I will just start by sharing my slides. Yeah, now I think I can do it. No, I'm not doing it. Strákar, hvað er ég að gera vitlaust? Okay.
When you share your screen, we see the website, so the browser.
Yeah.
Do you have two monitors or?
No, I only have one now, but.
Okay. So when you share, if you just share the PowerPoint presentation.
Yeah. It will come. It will just take a minute. So now I think I have it. Is it up now?
Oh, there's nothing.
Nothing in there.
There it is.
Yeah. a little bit of technical problems. So, hi. And I'm the lecturer looking for CEO because it's part of being an ADHD coach. I think that we work around the front part of the brain, and it's a big part of who we are and what we do when we work with people who are being diagnosed with ADHD. And I just wanted to start briefly on my agenda or who I am. I was diagnosed with ADHD at the age of 47 or 46. I'm 52 today. And the reason I got diagnosed was because before my sons were both diagnosed both at the age of 19 with ADHD. And like Sigrún told you, I've been working as a social educator for over 30 years with children and teenagers on the age of from 10 to 16. And my clients were with ADHD and also on the autistic spectrum. So I decided like 2018 to go to the ADHD Coach Academy in the States to learn more about ADHD, and I was only aiming for the teenager age when I started, but I have most of my clients, they are adults today, and they are both with ADHD and also on the spectrum. So I also have a diploma in cognitive behavior therapy. It's called CBT. And like I told you, I have graduated as advanced ADHD coach. And after I started that journey, I also took Yoga Nidra. There is, I think it's more or less like, the approach is like mindful approach. And it has shown that, research has shown that in that area, dopamine increases when you go to this Yoga Nidra sleep. And it's like meditation part of, it's a simple way to connect with your body and brain. I also am in a working group for ADHD coaching, connected with ADHD Europe. I've just briefly been working there for around a year. And I'm also a board member of the ADHD Association in Iceland. And the reason why I'm there is because as a social educator, I have always been working on the rights of human. So that was just something that I did. And I really do love working there also. So I know that people know what ADHD is, but there's a lot of conflicts and people not knowing too deep what it is to have ADHD. And the reason is why I'm saying this is, as a social educator, my field was working with ADHD people or young adults. And after I finished my graduation in ADCA, it was like the myth that we have around ADHD is young guys that are having difficulty with self-regulation. But it's so much more than that. And we talk about neurotypical versus neurodiversity. So I'm part of the neurodiversity group. And I sometimes look at it as, it's like the brain that we have, or the prefrontal cortex, who's here in the beginning of our brain, is not working in the same way as in the neurotypical people. And what does that mean? It means that the executive function in the brain that everybody has, it's not working the same for the group of neurodiversity. So neurodiversity is also people with or on the spectrum and people with dyslexic. So it has to do with the part of the brain that is here in the beginning in our head. So, and those skills, everybody has these skills, and they have been known as a 3 area of the executive function, and those area are the working memory, flexibility thinking, and inhibitory control. So it has to do with the way we use information. It has to do with how we think and the ability to go, what could we say? Ability to think about the same thing or the same object in a different way. And like most of us know that ADHD is about control or self-regulation. And it's not just in a behavior way, it's also in the way we think, in the way we act in a daily life. And this is part of, we have a lot of specialists, Dr. Brown and Russell Barclay and Nat Holloway, they have been talking about this executive function for many years. And it wasn't until I started learning more about this area of the brain that I was ready to accept my diagnosis, because I just lived a normal life until I started school. So people with this diversity brain, they have difficulty that is, in every daily tasks. It can be different between people with ADHD, and some people have a lot of difficulty, and on the other hand, other person can have just a smaller difficulty. So if we look at this executive function, everybody has that function in the brain. And they talk about the neuroscience that until we are 30 or around that 25 or 30, the brain is developing. But in that area, we can talk about delay for teenagers and young people. And they talk about altogether 3 to 5 years delay. And the difference between diversity and the typical one is like 3 to 5 years. So if you are like, we don't have the same growth in the Norwegian country. So if you are 16, it's like you have this executive function skills like 13 or maybe 11-year-old child. So going to school, having this ability is just like having, not a good start. So if I just zoom into this 3 skill that I've been talking about, it's like the working memory is the ability to keep information in the mind and then to use it in some way. I think that a simple way to explain that is you have like a short-term memory and a long-term memory, and you might have been studying for a math test the day before, and you go to the test and you don't show the result as the day before. So it's difficult to keep the information and use it in a way that other people can do. So this can be like a tremendous difficulty having a bad working memory, because it affects all area in life, and it can be shown in the beginning in school. So when the psychiatrists are diagnosing us with ADHD, they also look at the working memory. Cognitive flexibility, or we talk about flexible thinking. It was similar as I was talking about earlier, about the ability to think about something in more than one way. So it might look like you have a narrow mind because you don't have the ability to, like, if we go to the math again, don't have the ability to look at two aspects of the math thing that you are trying to find a way around. It's also the typical thing that we see in the computer world. And the myth is young guys playing some great game in the computer on the internet, and the parent come in and ask them to come for a dinner or something, and they don't have the ability to stop and do other things because they are in this game, they are focused on it, and they have difficulty with shifting around another task. And they talk about now you have to give them some time to go from one subject to the another one. And the third one is it's all around self-control. And it's the ability to ignore distraction and resist temptation. So I think this is maybe what people think that ADHD is, but it's so much, much more. Resist temptation has also been called addiction in the health system. It can be like ADHD is pronounced to have much more or higher rates in addiction, like alcohol addiction, drug, eating too much, smoking too much, or doing too much of all kind of things. So all those skills that we are lacking, they are just like driven to do too much of everything when we like it. And the brain, the ADHD brain, the drive for attention is when there's something that is interesting you, you can go all the way. Or maybe, yeah, do great things if you find the right subject. But those skills also have something that can be, yeah, I talk about, it's like this comparate, it's like you have a tree and the tree is your ADHD. And it's nearly, I never have seen like ADHD just stand by itself as a tree. We have to add something on it to make it, to make some barriers. And there are barriers around ADHD. I'm not going to talk about it just as a strength, but there's a lot of barrier that has hindered the life of and the aspect of living as ADHD people. So I just put it up, few of them. It's anxiety, it's well known, and depression. So, and in that area, there are like ladies with ADHD are getting more and more diagnosed here in Iceland, and I think all over the world. And they have been like for maybe decades carrying or going through the health system and had been diagnosed with anxiety and depression. And maybe the root cause is ADHD, and they are getting treatment and getting a better life. And on that tree, we could also add sleep disorders. And they are like a high percent of what we are dealing with. So sleep disorders can be like, if you are having difficulty with going to sleep or waking up early, it can be like for the prefrontal cortex, it's like you are hypering up the difficulty that you had before. And this is something that the coaches, the doctors, the psychiatrists are working with, helping people to find a solution in that area. This can also have a great impact in school. So there's also ODD, or it's called oppositional dependent disorder. It has to do with the behavior part of the people's area. And it's, you can see it as mild, medium, or high. When you look at the way it, you can see this part of, how do you say it? It's like the way it appears in people's life. It gets milder by days or by weeks or months, or as you grow older. And I have heard about 40 to 50% children have this part of disorder. It's like they have difficulty with rules, difficulty with going by rules, and they also have difficulty with behavior. It's like they're always opposite. This can be, it can be a very difficult disorder to work with, but we have, and the health system have a way of treating it or helping these children and teenagers to have a better life. And also known as Tourette syndrome and a tic. There is just a milder, or maybe another way of seeing the brain system. The Tourette with anxiety and ADHD can be very difficult to work with, and part of the teenagers that I'm working with are dealing with ADHD or being on the spectrum, having anxiety and Tourette. And also to put it on this tree again is like learning difficulties. And it's called a specific learning disability because it's the people with ADHD, they just have like, their IQ is just similar to others. And of course we have all the spectrum, but it's a difficulty with learning. And it's also related to the skills I was talking about before, executive function. So like reading an essay can be like, it can be very difficult and hard for some people. It can be part of math problems, language problem, all kind of problems. And there are a lot of complement other disorders linked to ADHD, like being sensitive or too sensitive, hypersensitive, and all kind of disorders. So this is something that a coach has to know about. And what is ADHD coaching? I got this picture from the internet, and it's Ellen Peels. She has drawn up a good way of seeing and helping us seeing what ADHD coaching is. It's, of course it is life coaching. It has to do with the same areas all the other life coaches are working with. And it's like helping the client to design his own life. And we work around the ethic and around every part of the daily life. Also the strength part of their life, and helping them to see the barrier of their life to go to the focus of the strength in life. So, and the other part is the skill coaching. And skill coaching is also like part of my work as a social educator. So helping people to move forward in a small steps or a bigger steps to see the whole picture, helping them to being motivated. We look at the strength, and we look at the strength by focusing on ADHD, because the barrier of ADHD is in that way, it has like people are having maybe a low or small self-awareness. They are more connected with the environment around them or not to themselves. So that's why mindful coaching is a good way to work with people to get connected with themselves. And there's also an area around just time, attention, self-care that we work with. And it's, of course it is something that we have to look at for each person. And the system, the way we operate, the executive function is part of this. And the next one is, it's all connected, like the ADHD education. I think that is a very big part of what we do, because if you don't know who you are and why you are having this ability in daily life, it can be like, yeah, you're like lost on the path. But by knowing that the brain is not working in the same way as for others, it can answer the question, what is ADHD? We also use the newest research about ADHD, the needs the people have for ADHD. The interest is something that is like the fuel for our life and the fuel for the brain. We also follow and we give them the tools if they need to get more self-educated. And there's like a support groups. There's we give them a hint about the local professionals, conference. It's like apps. It can be websites. It can be books. It can be, yeah, like I told you, support groups. They can be quite helpful just to meet people who are dealing with the same thing as you, and moving forward can be like the best thing that you can do. Yeah, it can be like an AA meeting. So this together has given the ADHD coach the path to work with the client. And we work with client in all ages. And it can be different between coaches. It might be what the coaches has as an interest, or what the coaches has studied before or learned. So like I am a social educator, and that's part of my knowledge, and I use it with my coaching. And there's also a part of it is like counseling. But this is the purest picture of ADHD coaching. And sometimes I have to add like a counseling with it. And also, and especially when I'm working with people on the spectrum, or like I used to call them myself, autistic people. So we have to be up to date and know what's going on in this, the field of ADHD. So client with ADHD, they have, of course, the same human needs as any coaching client. And however, they also face unique challenges that I've been talking about. They are related to the ADHD, and they can interfere with the quality of life. And it can be from just a mild path or to a severe or very difficult way of living. And these challenges, they are are related to the executive function, as I've been mentioning, and the brain management system. And they might include emotional self-regulation, and they often do. So it is cognitive and physical part of the ADHD, or the impulsivity or distraction, focus, and just make a decision can be quite difficult. Time management, or what we talk about as seeing the time, it's just like we are moving around in time. We have difficulty with maybe finish a task at the right time. It might be always being late, going late to sleep. And the focus is, it's a word that I've been thinking a lot about, because when I have interest and people with ADHD have interest, they have focus on what they're doing. And making decision is in that way quite difficult, because if you don't have interest and you don't know where the next step is, because of you don't see the time, it can be like the picture everybody sees is procrastinating. The short-term working memory is also having a big impact, having difficulty to knowing what you knew just a few minutes ago. It's just like, if you don't put it in the working memory, it's just like it's gone. So it's not about being stupid. So we also have so much trouble in the short-term or long-term memories. So we are trained to help adults, teenagers and kids and families with attention deficit hyperactivity disorder. And we are helping them to manage their life better. And when the client comes in, we always work with them from the personal way that they want to work with, like every other life coaches do. So this is, knowing what ADHD is something that is so necessary. The ADHD coaches, we have to support the client by developing the comprehensive understanding of both the nature of ADHD and the impact of the quality of the life. But it's known that medication is the first thing that is recommended to try when you start your path in learning about your ADHD or getting treatment. And we learn about medication, but we don't use that part of our education around that. We are just listening for how the medication is working for them. And we are not the doctors. We are a specialist in just listening. So they talk about medication as part of the first thing that is invited when you start your treatment. Also, next one is if you have anxiety or depression or difficulty in that area, you go to a psychiatrist. If the ADHD coach listen for that part of the people's life, like anxiety and depression, and it's not helpful, we give the client the names of the psychiatrists that they can see, because it can be like difficulty with coaching, or they are not coachable at that point, and they can come back, and then we can start working together. So managing ADHD can be all from being okay to being very difficult. and it can affect a few areas in life or all areas of life. A lot of people with ADHD have been going through burnout, or what other word you use for it. It's just like they have walked into the wall. I think they do talk about it in the Sweden. You have hit the wall, and they need help around growing as a person. So we help them by the coaches. We help them finding peace, finding a way to slow down. And we work in all areas of life, like with family, in workplaces, or for personal performance. And it's like we are not leading the way. We walk with them, and we create consistent process. And also, I have heard it from the state. They talk about we are also like a cheerleaders, believe it or not, helping them to see the positive part of who they are. So this was taken from the ADGA website. Now I have difficulty with moving my slides. Okay, so if the ADHD coach is the break specialist, Nat Halloman has talked about that the brain of ADHD people is like having Ferrari. It's like our brain is like the Ferrari race car energy, but we have bicycle brakes. So what does it mean? When I talked about self-regulation earlier, this is what I was talking about. For some people, you can see it because they have like hyperactivity behavior, but for the other one, is like the brain is like a race car. You can't see it, but it's part of what gets in the way for us to focus on things that are like daily tasks. And what the break specialist is doing is helping people to slow down so they can be able to see and live the life that they need or want. And there's also other thing that is called boredom. Have you heard about it? Boredom is something that we don't like. So we help them find interest in tasks that are difficult. We help them to motivate around that. And around education, it's like you have to be inspired and ready to go the path that you have chosen. So in a way, we are a break specialist, and we are helping the individual with ADHD to become their own break specialist and taking charge of the ADHD, knowing where you're coming from, knowing that you are just an individual person, but you have ADHD. I know that a lot of people talk about ADHD versus ADD, but that is, now we talk about it as an umbrella. So ADHD is just the whole picture. And under there, we have like the part of it's called ADD, that is like inattention. And then we have combined with a combined type, and the combined type is hyperactivity and part of the looking of the picture, and it's combined with inattention. So it's like they talk about three under fields in this umbrella. So ADD, we still talk about it, but it's changing and it's changing fast. So it's like the same education work for people who have this ADD or ADHD. But being on this, if you could call it like a spectrum, ADHD is a spectrum. It's people with high IQ, people with low IQ, people who are haven't had the ability to finish any education, have difficulty staying stable in work, and also that part of people with high education and having maybe a lot of trouble or not a trouble or a barrier. So ADHD it has a lot of what would you call it? It's having, yeah, it's all kind of people. We are not just like one. Yeah, we are like a tribe, but we are different. So, like I was talking about ADHD versus ADD, here we have a man that I look up to. His name is Nat Hallowell, and he is working in the States. And I saw a short video a few days ago when he talked about ADHD coaching. He has a lot of clinic in the States. He himself has ADHD and dyslexic. When he started practicing his health clinic, he saw that something was missing. And I think that he and the people who are working on this area and had been doing, they saw that we needed something strength, but not just looking at what's the failure or difficulty with having ADHD. You know, like if you look at them like patients, then it's something that you have to fix. But if you look at the strength, we know where we can walk from there. We can walk the path of knowing who we are and knowing what we want to do. So Nat is the one who talks about the brakes and the Ferrari. And he has put ADHD out there so the normal people can understand what it is. Of course, it is barriers, but it also has full of potential if you have the ability to move forward. So that's part of what we are doing. I know that if we are like a regular life coach and we have some education around maybe ADHD, it can be helpful. But I recommend ADHD coaching schools to learn about the difference between diversity, ADHD, or the normal brain, because we have a barrier that are unlike what others are going through. In the school system, there is a lot of things that has to be changed. And I know that the school in the Norwegian countries are changing, but I know they are changing slowly. I worked there for 18 years. And in that way, I was working as a special educator. I thought that I knew what was to know about ADHD, but it was far from that. So after I finished, like I told you in the beginning, the school in Datka, it has given me a deeper knowledge of knowing the rumination thoughts that people are going through, the overthinking, feeling overwhelmed in a situation that don't look so difficult. So this is something that is it's valuable. I still use the service of ADHD coaches from the States, and they help me around being in charge of my executive function, being able to help people understand why I'm overthinking, or maybe why I'm overwhelmed and just feeling like I'm stuck in some cloud. It's just I need somebody to help me walk the path sometimes. So I also need that cheerleaders in my life. In the part of this, when I talk about the path, is when you get diagnosed with ADHD, and when people or children get diagnosed with ADHD, they get the diagnosed. Okay, then they know they have ADHD. They might try medication, and some have some extra help, but it's too common that people don't know ADHD as it should be. You know, if you get diabetes, or if you get maybe Alzheimer's or Parkinson, you get it diagnosed, and then some of us need medication around that. We need to have education. We need to know from the deep root of our heart what ADHD is. A lot of people are carrying shame. They might have been diagnosed in the beginning of early life, and they can be diagnosed as now as a young lady or man, or a middle-aged wife or a woman with ADHD. The shame is something that is part of the cloud that we use. It has to do with the self-esteem. And if we don't know that this is part of the brain that is not working properly, and then I mean deep, just knowing that this is an organ that you can hold in your hand and it's not working properly, then it can be like you are living your life without glasses, or living your life without the medication or the insulin you need for your diabetes. So education is something that we really have to have in the coaching area. And when we get diagnosed, or when we go through the educating part of the ADHD, Sari Solden, she gave me permission to use this grief cycle for ADHD that she has drawn up in her book. And I really do like her work. This is a grief cycle that is similar to when you lose someone. And she has put it in this area of ADHD diagnosing. And the beginning is like you go through maybe a denial. And she has said that you don't go through all this area, you might slide away. And when you finish this cycle, it can be the cycle of your own success life. We go through denial. And I can connect with that because when I was diagnosed, I had like just a great life. I was super organized. My home was never messy. I like to have everything in a place. And a lot of things that happened in my life had was related to the path that I went to getting diagnosed. I went through burnout, 45 years old or so. And when I saw in Sari's book that she talked about over-organized ladies with ADD, indeed, I was ready to go and take my diagnosed longer and work the path that I needed. Anger can be like, if you look back and you're like, on my age, why didn't anybody see it? Can somebody help me around that? So bargaining and depression is seeing the deepest part of what you are going through, all your struggle that you have been going through. So this is a good circle to work with. And acceptance is something when you know that you know where you're coming from, but it's not gonna be part of who you are. You have ADHD, but it's not your life. So the path is something that we need to go through, and we need to go through it with the education about ADHD. So I think that I will stop here because I would like to take some questions if you have some. And I'm going to stop sharing. And give you some time to give me some questions. I'm just gonna do one thing. I will take the camera off for a while. And if you could open for questions.
Sigrún, there are a few questions already.
Okay.
In the Q&A. The first one was about where you can find the special coach education for ADHD.
Okay.
And so if you could address that maybe first, and then we'll take the other two.
Right. Okay, the education of ADHD coaches, I went through ADCA, with the ADD Coach Academy, but there are some other schools. And if you, you can use Google, and also send me email if I could send you some schools that are good. And the education is through the internet. And we have other good ADHD coaching school. But ADCA is what I went through, and my knowledge is there. So I will help you find a good school.
Good. And isn't it correct that you can find some good schools on the ICF Global website?
Yeah, I think so.
Yeah, good. Then we have from Ben Bowies, I think it's pronounced. I hope I'm pronouncing it right. He says, I'm a child and adolescent psychiatrist in Norway. My background turned certified coach. Who pays for ADHD
coaching?
ADHD coaches, and the parents, or do the coaches only work with adults who pay for themselves? And another question, there seems to be an unclear line between ADHD coaching and being a consultant. If you could say something about that challenge.
Yeah. Okay, two questions for me to remember. The first one was from Ben.
Yes.
In the States, I know that they have insurance issues, so I'm not sure if the insurance system pays for ADHD coaching, but there are a lot of people that just pay for itself. But I know that it's different between states is how this is addressed. Here in Iceland, and I know there are a lot of great coaches in, I know about it in Sweden, Denmark, and yeah, I know coaches from there. This is mostly paid by the adults or by the parent of the children or the teenager. But here in Iceland, we have the ADHD associated, and there we have like courses around ADHD for teenager, for young adults, for parents, and for adults. And we also have, yeah, like I have, and my sister, she's an ADHD coach also here in Iceland. I think we are the two that have finished it altogether. It's the union, they sometimes pay part of the coaching fee, also like for the life coaches. And yeah, it's a parent or it's the adult one. And also, I really don't have the word for when you have had to stop working because you are going through burnout or things like that. We have, yeah, I really don't know how to say it. It's called VIRK, and it's they pay for ADHD coaching or autistic spectrum coaching to help people move forward after the psychiatrists have finished working with the client around the thing that is holding them back, like anxiety or burnout, depression, and things like that. Yeah, okay, so the next question, I hope this did answer some of your question, Ben. I also want to talk about ADHD coaching versus therapy. There should be a difference between. There has to be a difference between. You know, I have diploma in cognitive behavior therapy, and I am a social educator. We call it, it was called diploma therapist earlier, or social pedagogue, I think in Danish. So my background is from the health system or therapeutic part of life or work, but there is a difference between, because the coach, the ADHD coach, he's listening for the language that the ADHD person is giving me. I have the ADHD lens on me when I'm coaching. I know a lot of things about ADHD, and that is connected with the photo I'll show you about skill coaching, life coaching, and education. And there is the difference, because we don't call it therapy, but it's, we ask for permission to step in and not tell them what to do, just tell them what the barrier, no, not the barrier even, it's just giving them the tools to help them move forward. But it's mostly, we have to listen with the ADHD lenses. We are not the therapist. And if people are not coachable and they are dealing with, like I told you before, anxiety, sleep disorder, or other things, we recommend that they meet specialists around that area. It's not ours to work with the anxiety, but we could help them by going the path of daily life and do it with support. We are maybe lowering the stress level, but we are not working with anxiety. So that has to be clear. Hope
Okay.
that, yeah.
Yeah, so thank you for that. There's another question. Do you coach kids or their parents? And if you coach the kids, do kids 12 plus listen to ADHD coaches?
It's a good question. When we coach kids, we, or at least I do, and I know my colleagues do, we have to, it's a family coaching. And that's also what is taught in ADGA. We have a course that's called family coaching. So if we don't educate the parents and we work on the coaching and educating the child around their ADHD, I think that if we don't educate the parent and we help them also moving forward, not just seeing that they are not, I'm using a title of a book, not lazy, stupid, or crazy, but they are capable of living life, but they need support. They need maybe support longer than others because of the brain. So we do work with the parents also. And kids 12 years plus, yeah, they do listen if they are ready to be coaches. So yeah, they do. And I work with from the I think from 10 years old. I think that's the that's the group that I work from, and just up. Yeah. So, and if you Google executive function coaches, please do so, and you will be amazed about what you can learn about working with children. There are great courses and schools all over the internet and all over Europe and the States. So that's what we have to learn also.
Good, thank you very much. One question before we finish, and maybe the others will just be able to contact you then directly for the questions they have. But Shahid was asking you if you could sum up the 3 strongest signs which can help to diagnose an ADHD person.
Wow, that is a difficult question. Very difficult. So if you're a coach, you asked a good question. 3 signs, because ADHD is different between people. I think what I see is starting a task, overthinking. When we talk about lack of focus, it's more like you have a great wide focus on a lot of things, and it's just like you are taking everything in. It's not like you have, when the focus is on dull things or something that you don't understand. So if you have a wide focus, and if you are ruminated or overthinking, and you have difficulty staying on track of things, no, this is too difficult question for me. But it's not just seeing hyperactivity. Nope, I'm not that kind of lady. It's in my mind. It's like my laundry machine is just moving too fast, faster than other machines. So hopefully I can, I can't answer this question too well, but because the old myth is that it's hyperactivity, people who have no filters and are going all over the places. But we are all kind of people. But if you have the instinct, just look for a psychiatrist and ask for help.
So thank you very much, Sigrún, for this very informative lecture. And Shahid said, thank you, Sigrún. I know it's a difficult question. So I thank you all for being with us today. And I think you're welcome to send any questions that you have directly to Sigrún.
Yeah, you're
You'll
welcome.
be happy to answer. And I hope I will see you in our other lecture in about an hour. So let's not make this any longer than it has to be. We are already a bit over time. So thank you all for coming. and see you around. Bye-bye.
Bye.